I'm guessing it's a sign of the times. A shortage of weight loss drugs, such as the newly released Ozempic rival Zepbound, is forcing desperate customers to drive as much as 5 hours to find the pharmacy that has the medication in stock. Pricey medication at that. It's kind of like the new Tickle Me Elmo. This Zepbound, released last November by pharma giant Eli Lilly, is in limited supply through the end of the month due to what the FDA, the Food and Drug Administration here in the U.S., says is a demand increase. And the demand, it's so high that the FDA, yes, the FDA, has said in a press statement that patients looking for the 5 milligram and 12.5 milligram doses of the drug will have to wait due to, in quotes, limited availability. And as expected, what has this done? Create a Reddit thread about the leaps and bounds hurdle to get this drug, which, by the way, cost $1,100 for a 1-month supply. The Reddit thread even includes anecdotes from other users who have struggled to fill their prescriptions. One woman even driving 5 hours round trip in Minnesota in order to get a hold of a 5 milligram and 1 box of 7.5 milligram injections. Desperate times, I guess, calling for desperate measures. Again, I guess. Now, an Eli Lilly spokesperson has already responded to the shortage and stated in a note that the company plans to boost its spending on production to address supply concerns. In quotes, while we anticipate intermittent availability in the near term due to unprecedented demand, we expect our investments in manufacturing and supply capacity to progressively increase production of Mounjaro and Zepbound throughout the second half of 2024. And Zepbound, that's a relatively new drug. It was just released last November, and the FDA approved Zepbound as a weight loss management treatment for people with obesity. Zepbound is marketed as a diabetes drug under the name Mounjaro, and both medications have the same active ingredient. It's tirzepatide. While Mounjaro, also made by Eli Lilly, is approved by the FDA to treat type 2 diabetes, Mounjaro's availability also limited due to a demand increase. And yes, I guess it's just a sign of the times here in the U.S. And I say the U.S. because, well, data suggests that, as Novo Nordisk, that's the Danish manufacturer of Ozempic and Wegovy, has not only raked in billions of dollars from the sale of the weight loss drugs, but 2/3 of sales of Ozempic right here in the United States, while more than 90% of Wegovy sales went to companies here in the U.S. These weight loss injection drugs, apparently a big thing here in the U.S. Hopefully these people taking the drugs are eating better and exercising, but one can hope, right? What do you all think of this weight loss injection drug shortage and the insane measures taken by some people to get their hands on these drugs? Is it just a fad, or will it get even more difficult to get your hands on these weight loss injections for a long period of time? Have you guys taken any of these products, and what has been the result? Share your thoughts in the comments below. And for Modern Wall Street, I'm James Swinney.